to another episode of the Tee List. I have my amazing guest,
Graphically,
Felicia.
but I want people to picture it to understand. Surgery is a tool that's in the tool basket, but it should be the last tool that should be used, right? So let's get to the root of the problem, and if that root can't be pulled out and fixed, fine. And if surgery is what's needed, then surgery is what's needed. But that can't be your first go-to, right? Then another one is uterine artery embolization. So what does that mean? They go up into your, through your femur veins, right? And they go into your uterine artery. This uterine artery supplies blood, supplies the main source of blood and hormones to the uterus. And they embolize it. What does that mean? It's like to cauterize. So they almost like kill it. So now you have a lack of blood flowing to your uterus because they're saying, oh, it's the blood supply that's going there that's making it that way. That's still not the root of the problem. The root of the problem is your lack of exercise. The root of the problem is what you're putting in your body. And then if we talk about what we're putting on your body, there's a lot of toxicologists coming out now talking about all of the endocrine disruptors and the PFAS things that are in our lotions, our soaps, the perfumes, the aerosol deodorants, and all of these things are affecting us in our estrogen. So we as women carry all the eggs that we will ever have in our life. So that means, so I'm pregnant now. So that means if I have, thank you, if I have a problem with my endocrine, I also carry the eggs if this child is a girl. Right? Yeah. So that means I'm passing on my problems to my female daughter that hasn't even been born yet, but her eggs, right, is currently growing inside me. Her reproductive system is currently growing inside of me, and that's giving her problems as well. So now here we go with generational health problems. Because of what I did, maybe what my mother did, and so on and so forth. But my grandparents and my great-grandparents didn't have the quality of food that we're eating now. Oh, yeah. The quality of food is not good. Right? So we as women, even for our sons, same thing. He has his testicles where his sperm and all this stuff is. What are we doing to them when they grow and now their sperm count is low or their fertility is low, and then however they treat themselves is just going to make it worse. So we have to kind of think about future and just don't think about, oh, me right now, because we affect what's going to happen for the next generation. Just how like all the talks that you have, and hopefully this talk that we're having is going to affect future generation, is going to hopefully just spark the one brain that's going to go out there and try to change something and make a difference. Right? So that's how we as a people need to go back to thinking.
What factors like genetic, environmental, dietary might contribute to the high prevalence of fibroids in Black women?
So definitely your dairy, high in hormones, your milk, your cheese is out of control. When I stopped cheese, it was very hard for me too. He was like, I can't live without it. But they put enzymes in it to make you crave it. It's almost like a drug. And if you look it up, the enzymes in it is almost, it has like this dopamine effect that makes you say, I need it, I want it. So try to go without cheese for a couple of days. Those that are like big cheese eaters, my mother's always say I was like a mouse when I was little. And you have this like, I gotta have it type of thing, right? So dairy is definitely a factor if we're talking about our foods. Our poor chickens are just loaded up with hormones. The breasts need to be bigger, the thighs need to be bigger, just to satisfy the population. People were going crazy for a chicken sandwich that closed down a couple of years ago. Do you remember that? They were fighting in the street. Yeah. Okay. But it's serious if you look at it. It's funny, but it's serious when you really take a look at it. Like people are acting, because you are what you eat, right? Mm-hmm. But it's that combined with the lack of healthy things, the lack of vitamins, right? People rarely eat vegetables, like there's nothing green on their plate. People think, oh, I got potatoes, I'm good. No vitamin A, no vitamin E, no B12. Like there's nothing else other than the rice and the chicken. The sugars are insane as well. White sugar is horrible. Brown sugar is a little bit better, but we need to start getting away from all these artificial sugars. Also the processed foods, Again, I'm plant-based. I try to do my best and not eat processed foods, all of this impossible meat and whatever, like all of this other stuff. I used to eat meat. I used to eat everything under the sun, so I know what it tastes like. I'm like, this tastes too much. Too much like the real thing. Y'all sprinkle something in it. Yeah. I can't be bothered, right? If we look at environmental things, just the normal things that we're around. So I work in a hospital. What am I around? I'm around medications that get aerosoled in the air, right? Whether they're injectable, whether they're aerosoled. If you think, when we say aerosol, if you think about someone who has to take a nebulizer because they have asthma and you see that smoke coming out, right? Oh, yeah. So that's not the only, it's not only asthma medications that do that. There are other things that do that as well. I used to work in a nursing home, so a lot of the medications that we crush and get powdered out in the air, some of those things we're supposed to have masks and gloves that we're wearing. We give cancer medications, right? A lot of those things seep through our pores and through our fingers. So outside the smog and the pollution and the stuff that we're breathing off of cars, you think that they clean the filters on the bus? Or the filters in your office room, or the filters in a hospital, right? Yeah. Like these air filters, I've worked for a long time. I haven't seen them once clean it. Do they do it at night? I don't work at night. Maybe so. Okay, I ain't trying to throw nobody under the bus. But these are the things that you have to think about. Do you have air filters in your home? You have a gas stove. Mm-hmm. What's that extra gas when you turn on the oven or you light the burner? What's that coming out, right? Some people burn like mail and grass and all these other things. So all of these pollutions affect us in some type of way. Yeah. And the thing is like, well, there's toxins everywhere. So then how are we you should be detoxifying yourself. We do that through foods. We do that through cleaning out the system, right? Nobody does that anymore. So we're just loading. The body has its own detoxification process. But at the same time, if you overload your system, there's only but so much that your body itself can do. We're perfect machines, but if we're overload the washing machine, those clothes ain't gonna get washed well. Yeah. So it's the same concept. Yeah.
So how can fibroids impact fertility and pregnancy outcomes for Black women?
So because of the location, as I said before, of the fibroid, it makes us more difficult to get pregnant, right? If the fibroid is in a space where the pregnancy would grow, then there's no room for that pregnancy. Our bodies are perfect machines. As women, we are meant to be, as females, we are meant to be pregnant. Yeah. If we have a hormone imbalance, the body's gonna be like, nope, something is off, well, we're not gonna get pregnant. Something simple as if we're severely anemic. I had a friend, very severely anemic, and she told me, I know if I start taking my iron pills, I'm gonna get pregnant quickly. And I'm like, well, girl, if you want to get pregnant, just take your iron pills, right? So the body recognizes when something is wrong. And even if you still get pregnant and the body recognizes that there's something wrong with that pregnancy, whether it's location, whether it's something genetic, anything, body's going to say, nope, we're going to do away with this pregnancy, and there you go with a miscarriage. So location of the fibroids, takes up the space of the baby, the imbalance of the hormones because of the fibroids or the number of fibroids that you might have can affect your fertility and how easily, I should say, you get pregnant. Because once we're pregnant the first time, the body's like, oh yeah, party over here, we're going to get pregnant again. And it's easier the second, the third, the fourth, and the fifth time. Oh my God. But if your body is off balance, you don't have that balance, that homeostasis as we call it, it's going to be a problem. And those fibroids throw off that homeostasis. Yeah, completely.
What are some early signs and symptoms of fibroids that women should watch out for?
So definitely irregular bleeding. So if your periods were 3-4 days, now they're a little bit longer, maybe a little bit heavier. Maybe the color has changed from this like bright red to this dark burgundy. Mm-hmm. Maybe the smell has changed from, we all know what blood smells like, but it can be this almost like thick, heavy, I don't want to say rancid, but like thick, heavy blood that you can smell even not using the bathroom. All of these are changes, hormonal changes. Yeah. We should all be going to get checked up at least every 3 years, I should say, as long as everything is okay. And we should be having a sonogram and getting checked because you can only detect it by seeing them. Mm-hmm. Right? So you get a scan, whether it's abdominal or transvaginal, and they look at the size of the uterus. If you feel like you're gaining weight for no reason, just like the pants are not fitting right and it just keep on getting tighter and tighter, right? That weight gain could be your uterus, not to say that your uterus is growing, but you have growths on your uterus that's actually increasing your abdominal size. But the earlier signs is the irregular bleeding. Because once the irregular bleeding, growth in abdominal size, and then afterwards it comes pain. So once you have the irregular bleeding and then the growth in your abdomen, then it's usually the pain comes after that. And the pain is what prompts people to go to the doctor. And then usually you get what you get when you go there.
Are there treatment options that are available, and how do you help women decide what's best for them?
Multiple treatment options. If we go the medical route, then you know it's the surgery, is the embolization of your uterine arteries. But before we get to the crazy bottom of the tool bag, for me, when I see patients and I'm looking at the fibroids, then I have to look into you and your lifestyle. And I'm going to tell you to change your eating habits. I'm going to tell you to start doing those abdominal exercises, those core exercises to help shrink the fibroids, right? And usually those two things work, but people have to be patient because it's not like you pop a pill, you take a surgery, and then boom, they're here one day and they're gone the next day.
People like quick fixes.
Quick fixes. The fibroid didn't just pop up 6 centimeters yesterday.
Yeah.
You probably had it for 6 years and it grew a centimeter each year. And now it's 6 centimeters and you're pain and it's bleeding, right? So they have to be patient and make lifestyle changes, but understand that those lifestyle changes, once you make them, don't go back. Because then it's going to come back with a vengeance. Like whatever you change, you take your time and change, and then you stick to. So dietary, exercises, and this is why I don't say diet, because you're not dieting. You're making a lifestyle change. Also castor oil packs. So castor oil is amazing. They actually pull toxins out of your body, pull things out of your body. So my midwife told me castor oil packs work really well, and there's actually a health food store on Utica Avenue called Utica and Eastern Parkway.
Okay.
Within like the first 2 blocks. I don't know the address exactly, but Ujima is what it's called. He sells castor oil packs. He's been there for ages. And you put it on, you heat it up and you put it on, and it helps to draw the toxins out and it helps to shrink fibroids. And there are many women that I know that have used it and it's like, oh my God, this works so well in combination with everything else.
Of course, yeah.
So what I said, lifestyle changes, exercising, the castor oil packs, overall eating healthy. Well, we got to put vitamins in. And people think, damn, I got to pop a pill of vitamins every day. No. Get your blood drawn. Figure out what you're deficient in. Take that vitamin for 3 months and then stop. Let your body absorb whatever you've just been taking for 3 months every day. Go get your blood drawn again. Your levels are normal, you're good. Now just maintain it. Some people think every day for the rest of my life I have to take this vitamin. Absolutely not. Now you're basically poisoning yourself. Too much of a good thing is also bad.
Yeah, everything in moderation.
Everything in moderation. For us, we're some people. We need vitamin D, girl. Improve our gut, improve our skin, improve our hair.
Yeah.
Like, I give my children, my family vitamins in the winter. We're not outside. We're all covered up all the time. But during the summertime, I'm like, get out of the house. Go outside in the backyard. Even if you just sleep out there in the sun, just don't get burned, right? But go be outside. Yeah. Vitamin D is like our best friend and our most natural sources from the sun. Everyone up here in North America, vitamin D is deficient. I'm sure I'm deficient too, right? Because, I'm inside and I work a lot. But we have to see what we're deficient in and try to improve that. Especially for our young girls. Our young girls, like before they even start puberty, they should be checking vitamin D. The moms helping them check vitamin D, taking those supplements, and making sure that they're building that bone structure. Because when we could become menopausal, our estrogen goes down, and so does our bone health. And this is why a lot of us have osteoporosis. Our bones become brittle. It's because we didn't build it up when we were young. And now we think just popping a pill because we're older. It's just, again, another Band-Aid over a gaping wound.
Yeah. What's the importance of educating Black women about the reproductive health from an early age?
It leads to generational health improvement. So I know a lot of people like generational wealth. So generational health, right? So if I know what I know and I'm teaching my young daughter, I would hope that she sticks to what she knows is right because it makes her feel good, not just because mommy is saying it, and she will pass that on and pass that on and pass that on. And maybe we won't have these deficits of not being heard, or these deficits of not knowing what to get that's natural, not knowing our bodies, right? My midwife is great. She does these walks in Prospect Park as, oh, there's burdock, oh, there's this, oh, there's that. There's these healing plants that are all around us that people just look and they just in the street, they grow in your backyard, you know, you just mow the lawn and don't even care, not knowing you can pick them and drink a tea and it'll help flush your liver out, or help flush your kidneys out, or help, you know, with brain improvements, or clearing out your fog, right? So all of these traditional health benefits that we've known from the beginning of time, we've let it gone to waste because we think that Western medicine is what it is. And that pill that we take, that doctor gives us, is what's going to make us better, when that's not even a cure. That's just, you know, placating us for the time being, right? But if we go back to that, and if I can teach my children that, if I can teach you that, if I can teach whoever I speak to, then we're going to spread the word, and people are going to be like, well, you know what? Maybe I need to drink more water. You know what? Oh, I'm feeling this. Maybe I'm going to do that first before I'm going to go spend that $50 copay and go to the doctor, right? I mean, it kind of is what it is. Things are getting more expensive. We have to revert to something that's a little bit more natural, a little bit more common sense, right? Common sense goes a long way. Yeah, but it ain't so common.
No, it's not. Have you personally seen improvement in outcomes when Black women work with midwives?
Absolutely. You're one of them, right? You just gave me your truth. But I find that anyone that I personally work with, it's an overall improvement. And then they're like, I got my neighbor to come and see you. I got my aunt to come and see you. Because when you feel good, that's the truth. It's not what I'm telling you. If you do something and it makes you feel good and you're like, oh man, this is really working for me. And maybe one treatment may not work, but something else does. But when you realize that it does and it makes you feel good, it's like you want more of that. That's just like good food, right? Like, damn, this is good. I want some more. Give me a second plate. I know I'm full, I'm being greedy, but I want a little bit more. So you see that they long for something different because we've been getting the same rhetoric over and over and over again, and people are tired. When I was in private practice, the majority of the women that I saw, that's what it was. I'm tired of seeing these doctors and they're just telling me birth control. They're just telling me a pill. They're just telling me. So they see my head wrap. They see I have a skirt. They're like, oh, you're a Rasta. You got to know some natural stuff. And they're like, please help me. And then I'm like, okay, go to the store. Take this tea. Try to do this. Try to do that. But have patience. Come and see me in 3 months and then tell me how you feel. Yeah. And they look completely different. They sound completely different. They feel completely different. So that's, as a midwife, and in regards to midwifery, that's what we bring. We want you to make the change. I'm just holding your hand and I'm walking down that path and guiding you. But when you see and feel that it's right for you, you're gonna come and seek that knowledge, because all of those who were chosen, they chose themselves. I didn't choose anybody.
Yeah. So I want to talk about home births. But before I start about it, I was watching this show about a whole bunch of, it's a reality show, and a couple of them were pregnant. Okay. So one of them, she had 2 kids already. The second one, she barely made it to the hospital. She was about to give birth in the parking lot. Okay. So she went, she saw her provider, her doctor, and she's like, I want to do a home birth. What do you think about that? And her doctor was like, it's dangerous. You know, I'd rather you in the hospital because there's just too many risks out there. So with that being said, what are the main benefits of choosing a home birth? First is
your choice. Those who really want it will seek it.
Yeah.
It's more family centered, right? It's not like, oh, you only got 2 visitors in the room, right? It's whoever you want there that's gonna love and support you in the way that they love and support you. Less intervention, right? Less instrumental intervention, right? We're not cutting you. We're not stretching you.
Yeah.
We're not keeping you in the bed on your back. Blood pressure cuff here, monitor here, IV here, and you're like Patrick Star in the bed, right? So I think you have that freedom of movement. It's, again, this is like back to nature, back to something that's natural. People need to understand, yeah, there are risks to it, but if you plan it accordingly, and if it's something that you really want and you do the work, then you reduce all those risks.
How do you handle emergencies during a home birth, and what protocols are in place if they need to be transferred to a hospital?
So New York State, or we live in the city, so New York City makes it very difficult for the home birth practicing midwives. What it should be that a midwife is working hand to hand with a hospital and notifies them, hey, I'm going to deliver this person at home, and then, I might need to bring them in, and they're kind of aware ahead of time.
Yeah.
But because we don't have that collaboration in the planning process, the midwife makes sure that the hospital that is nearest the patient is within 20 to 30 minutes, because legally, even for private doctors that deliver someone in a hospital, they have to be within 30 minutes of being able to arrive to the hospital. So there's a hospital at least that's 30 minutes away that's capable, God forbid, of doing a C-section or instrumental delivery or something like that for the patient. You have the records available. Midwives, when they do home births, oxygen is available, suction for the baby, and mommy is available. Some of them carry the medication everybody knows about. It's called Pitocin, that we can give in case the woman is bleeding. So there are things that are set in place, of course, according to what the woman desires and what's safe. But in regards to doing a home birth, where safety comes in is in the planning stage. It's not in the middle, and it's not in the end. It's the planning stage, checking all those boxes, making sure that the person that wants to deliver at home is a proper candidate to deliver at home, making sure that they're doing the work during their prenatal period to make sure that they're healthy to deliver at home, and they also aware that if anything happens and I'm just like, hey mommy, now you're diabetic, now you have high blood pressure, listen, you have to go to the hospital. And then hopefully the hospital that you do have that's nearby is midwifery friendly, so that way you won't be taking over her care when you go there, but that you'll be able to at least be there for her and still support her, during her delivery.
What do you say to those who worry about the safety of giving birth at home?
You have to ask them what are they worried about? What do they fear? Everyone has different fears, right? Some fear the pain because they can't get epidural, right?
That's me. Zero tolerance for pain.
But you see, so this is the thing. You know yourself, and if you know yourself, and if you know maybe the natural treatments of walking or rubbing or massaging the back or doing our counter pressure ain't gonna work for you, and you're gonna want that epidural, then you know that the house is not the place for you. Then it's the hospital, and then your alternative would be finding a midwife that works in the hospital to create that home birth environment for you.
Yeah.
Because you don't have to be in the bed. Well, until you get your epidural, right? But you don't have to be in the bed. You're gonna have the wires on, or the monitors on for the baby, but you can ask for wireless monitors that allow for movement, right? If you don't have no blood pressure issues, why are they taking your blood pressure every 30 minutes or every hour? You can request for them not to. Here we go in advocating for ourselves and knowing what we want, right? You have your doula there. They can still do the counter pressure for you. They can still walk around. You can have your partner there. You can have your mom there, right? Those who are going to support you and give you the energy that you need to get you through this marathon that we call labor, right? So you can always convert that home style of birthing into the hospital, but you have to know what you want and advocate for that once you get to the hospital. Listen, I work in a hospital, and when they tell me, listen, I don't want to do this, I'm like, that's good. You ain't got an epidural, so you better get up out of that bed. The birthing ball is there. You better do your yoga, do whatever it is. As long as it's safe and as long as I see baby's heart rate is good, because I'm bound by rules because of the facility that I work in. Other than that, I don't mind. We had a delivery today. The woman had her doula. She was doing lunges all around the room.
Wow.
And she delivered in 3 hours.
Oh, wow.
And I said, do your thing, girl. Do your circuit. And it's going to work. Because historically, we are not meant to labor and deliver on our back,
Yeah.
right? So if you get up and you do the work, then that's fine. But getting down to the root of what they fear. If it's pain, we can work around that, right? Unless you know absolutely like zero tolerance, sorry, right? If it's bleeding, then I can tell you, hey, I carry this medication or I carry this herb that works better than this medication, right? If it's, oh, it's just you, but what happens if something's happening with me and something's happening with my baby? Okay, if you need them, you can have 2 midwives instead of 1, right? When I was having twins at home, I had 2 midwives instead of 1. And it wasn't me, my midwife was like, there needs to be somebody else. Because there's only one of me,
Yeah.
right? It's, what happens if I have to get transferred? Then it's, okay, this is the hospital that's near you. Do you feel comfortable with that hospital? Do you want to go there and see that hospital? Let's investigate if they're home birth friendly or midwifery friendly, so maybe you can convert your care there, right? So it's getting down to the root of it and seeing if we can, or rectify those fears, I should say. And then if we can't, then listen, have your little birth plan of what you want and bring it to the hospital and have that communication with the provider before you go into labor, so you have your expectations.
So I was watching the same show, and it was 2 girls. They were both pregnant, and one of them was like, "I want to do a water birth."
Okay.
And the other woman said, "Girl, no, you know you poop. You don't want to poop in that water. Everyone poops." And I'm like, this is so cringing because I have to talk to Felicia and got to get on this podcast and let viewers know not everyone does.
Right.
I definitely didn't.
Right.
So that should not be a reason to deter someone from water births.
Absolutely. Not everybody poops. And I think it's because the majority of us say, push like you're pooping, right? But I think we say that just for you to use the right muscles. Because if we say bear down, people grab and pull,
Yeah.
right? But bearing down is a different sensation. You're using a different set of muscles. But no, not everybody poops. And then if you want to go around the poop, we can always do an enema, which is natural. Just soapy water in the bottom to clear all of that out. So if you're going to, push like you're pooping, ain't no poop going to come out because we helped you. Okay? But I had my experience with doing a home birth with my midwife, and the person wanted a water birth, and it was my first time. She's like, Felicia, hey, do you want to experience this? Have you done this? I was like, oh, I'm all for it. It's for the relief of pain for the woman. I did, my friend who's a nurse practitioner, she had a home birth. She said the moment she got in the water, it was like her contractions just went away. Or at least the feeling of the strength of the pain. Because if you think about it, you have that water pressure that's encircling your body, right? So that helps relieve you and make it just a little bit more bearable, right? And then the baby transitioning from basically a water breather still into water and now coming out now into this cold somewhat air. We try to make the room warm. Into this extra uterine life now to become a air breather. It's a more gentler experience for the baby. So it works 2 ways, but it's mostly for the comfort of the mother to be in that water. And then the water is clean. It's not like she's going in and out and you got dirty feet and they're tracking mud all over the place. It's not one of those things, but we make sure it's clean. We make sure it's safe for mommy and baby. So for all of the people who are thinking, oh my God, I'm going to poop in the water. No. And if you do, like, so what? It's not a big deal. It's not like you're swimming in it for forever. The baby comes out. You're in there for a few minutes, and eventually you come out and the placenta comes out. The placenta doesn't come out in the water, obviously. You're going to come out with the baby still attached. And the placenta comes out, cord gets cut, and that's it.
Yeah, you make me want to have a water birth. And the water pressure is right, because whenever I have pain, my family can tell you I get in the shower because that water helps me. So I'll go in that shower, I'm in there for like an hour and pain goes away. So consideration.
Yeah. I got you, don't worry, I got you.
So you just mentioned that you have had a home birth. How was your experience?
Well, as I said before, I'm pregnant again, so this is number 9. So I had 7 home births of my own. Never had a water birth. I'm considering doing this, so I'm trying to convince my husband. He's like, whatever you want to do, babe. And I say 7 because one of them were twins.
Yeah.
I'm going to talk about the first time, because the first time I think is the most important time.
Yeah.
And I think if the first time is traumatic, then nobody will ever do it again.
Yeah.
And it was my husband who wanted it. It wasn't even me. So growing up, I saw my mother deliver my younger brother in a birthing center. And I want to say 7 years older than my younger brother. And I was there with my mother's friend, and I'm there just watching like, okay, like it's nothing. So I knew, okay, my husband doesn't want me to be in the hospital. Okay, I understand. So let's do a birthing center. And we were living in Brooklyn at the time, and we were going all the way to the Bronx. That was the only birthing center we knew.
Wow.
And the birthing center was like, we would love to have you, but how you gonna get here? I'm like, the 4 train. I was young, I was like maybe 18, and she's like, so you're gonna have the baby on the train? Because we're not gonna induce you, we're gonna wait for you to go into labor on your own.
Oh my God.
And I'm like, we end up through a friend, we lived in Brooklyn through a friend or somebody, we end up finding the midwife that I still have now. And she has delivered like all of Crown Heights, Brooklyn. Right? The woman is like blessed from God. She's like an angel that has come down and is on this planet Earth, from the Almighty. And I think I met her probably my early 3rd trimester. She's like, yeah, I'll deliver you. Like, just nonchalant, easy. I was nervous because it's the first time, like the what if.
Yeah.
But she made me so comfortable with the explanation, with if this happens, then we can do that. If that happens, then we can do this. Mm-hmm. So there was always a plan in place. So there was never no holes. It wasn't like Swiss cheese. There was like an unknown. She was an older woman, so she was doing this for a while, delivered probably thousands of babies before she even delivered my first. So I was confident in her skills, but just nervous because it was my first time.
Yeah.
I remember going into labor. She comes, and she had younger children at the time. She checks me and she's like, yeah, you still have a long way to go. Drop her children off at school, came back, sat with us all day, walk around, do this, sleep, drink, you want tea? That's it. Like, I'm in my home. Yeah. Walking around like nothing, rubbing my back. She's breathing with me. She's keeping me focused. She probably checked me twice. When she came and told me I had still a long way to go. And then the second time when she was like, okay, get into whatever position you want and you can push. I was like, what? What position? I can't. What position? And she's like, well, you could try on your back. That was like the worst experience ever. And I'm like, no. And I end up squatting. She's like, just listen to your body. Get into whatever position your body tells you. My body told me to squat. And that's it. And then, my daughter came because my first child was a girl. But she was there for me. Like, there was like this connection that I can unload my fears and whatever responsibility of that moment, and I know she was going to hold it with respect. And even now, like, she's technically semi-retired, and I'm like, I'll fly you up from Jamaica because ain't nobody else delivering me. Because ain't nobody else. So my experience was beautiful. My husband was able to be there. It wasn't, nothing was a rush. Like, we didn't have to rush and go nowhere. She wasn't in a rush to leave or deliver someone else. Mm-hmm. It wasn't a rush to get the baby out. It was, listen to your body. Do whatever your body says. I don't need to tell you. Your body is telling. She was the one who made me listen to myself and really know and be the midwife who I am today. So I have to give all praises and homage to her because she's a great person. And I'm glad I had that experience so that I can give that to everyone, whether they're in the hospital or if they're at home as well.
I know that you are pro-natural medicine. Do you have anything you're working on to offer to the community?
I was speaking to another midwife and she told me something profound, that in this year she was going to try to be more, have her more her voice be heard in the community. And it's funny because it was right after you asked me to do this. And I'm always thinking, I want to go back to private practice. I want to be able to speak to people. I want to be able to, like, how am I going to do that? And I don't have any time even for myself.
Yeah.
And I'm like, and then she told me that, and she invited me to one, and then you have me doing this, and I'm like, no, this is actually a great way, trying to just have your voice be heard. Mm-hmm. And then another hospital asked me to speak about Black women having more C-sections because this article came out in the New York Times about hospitals trying to fill up their operating room. So what was meant for me is meant for me, and I guess being able to have a voice is what's meant for me right now, right? I want to do more, and we'll see what happens with doing more. But it's little steps, little steps.
So if anybody does have questions, they can reach out to me and I'll relay the message to you. 'Cause
Absolutely.
we know you are very busy.
Absolutely.
But my friends have been like dying to see this episode. They want to see it because they're like, I've been looking for somebody and I can't find. I've been shut down. So I'm really happy we were able to do this together.
That's great. I'm happy too. It's super important.
Yeah. Is there any final words you want to give out to the viewers today?
To all of our beautiful melanated ladies, love yourself, know yourself, speak up for yourself. I can't even tell you how it's important. And keep on looking, like how your friends are still looking. You know, even if it's not me, there are so many of us out there. A lot of us also are retiring. But keep on looking. There are good doctors out there too. I can't just say, only midwifery. The majority of the old school doctors were taught by midwives. So they do have a midwife mentality, right? So just find that person that you connect with and you sync with, you know? And just do the best for your body. You got one life to live, but that don't mean you gotta go crazy.
Yeah.
Right? Live your best life and live your best life healthy, and you'll see the benefits once you start feeling good.
Thank you so much, Felicia.
Thank you for having me. It's a blessing. Thank you so much.
Thank you.